Prolad da, good afternoon everybody. We're here today to discuss the next steps we are taking to enable some of our young people to return to school. And I'm joined by the Deputy Chief Medical Officer, Dr. Chris Jones. I would first like to put on the record my thanks to Dr. Jones and his team who continue to work around the clock throughout this pandemic, ensuring that ministers have the most up-to-date and accurate advice and evidence when we're making our decisions. Before I go on to the subject of schools, I'd like to start with an update on vaccinations. The very latest figures, published just minutes ago, show that we've now passed the 500,000 mark for vaccinations here in Wales. And I'm sure all of you, would like to commend our NHS and everyone else who was involved in this tremendous effort. So, on to education. Our independent technical advisory group are today publishing their latest evidence, so that everyone can see what has guided the Welsh Government's decisions. The group have been very clear that in order to have the headroom for pupils to return to school, there are national indicators that must be heading in the right direction. So, Dr. Jones will now briefly present and explain this data. Dr. Jones.
Thank you, Minister. The Technical Advisory Group has published a new paper today showing the current position of the pandemic in Wales and providing advice about how schools could start to safely open. We're clear that the ability to relax the current restrictions remains limited by the presence of a new variant which is more transmissible than before. However, with the R value currently below 1, there is some headroom for a phased return of primary school children, who have a lower risk of infection, but who are at risk of harm while not in school. To enable restrictions to be eased in any way, we need to see positive trends in a range of data. I'm pleased to say that case numbers, levels of community transmission, and test positivity rates are decreasing. And I'll now just take you through this data. As you can see from this plot of weekly coronavirus case rates in Wales, you can see a steady and consistent fall over the last few weeks. We've fallen back from the peak of 650 cases per 100,000 people to around 127 cases today. In fact, cases are now lower than at previous points when schools were fully open. This is really encouraging, particularly given the presence of the new variant, and is the result of everyone's efforts and sacrifices over the last 7 weeks of restrictions. This is the slide of hospital bed occupancy, showing suspected, confirmed, recovering and total coronavirus cases in our hospitals. Any relaxation of measures should be undertaken in a phased way, looking at the balance of harms and our continuing assessment of the risks, including the pressure on the NHS. As you can see on this slide, while the total number of people in hospital with coronavirus remains substantial, it has stabilised and is starting to fall. We will monitor this carefully alongside our other indicators in assessing the potential impact of any changes before each new phase of more pupils returning. Keeping the reproduction number, the R rate, below 1 is also an important measure in allowing a return to more face-to-face learning. As you can see from this slide, which is based on SAGE estimates, the R rate is currently estimated in Wales to be between 0.7 and 0.9, consistent with falling case rates. It compares well to the position in the summer and is significantly down from the period before Christmas. Before handing back to the Minister, I want to give a quick update on our vaccination progress. On this slide, the Wales vaccination progress, and this is also reported in vaccinations per 100,000 people per week, shows how we have accelerated the rollout of the vaccine programme. And as the Minister has already said, more than 523,000 people, more than 1 in 6 of the population, have had their first dose of the vaccine. This slide clearly shows the speed at which we're vaccinating people in Wales. In the last week, we vaccinated more people as a percentage of our population than any of the other UK nations. And we remain on course to offer vaccinations to everyone in the first 4 priority groups by mid-February.
Thank you, Dr. Jones. We have been clear that our children's education is a priority throughout this pandemic. Sadly, we are not yet in a position to be able to see a full return to school for every learner. However, thanks to people following our national guidance, there is sufficient headroom for us to bring some of our learners in a phased and flexible, progressive way back into the classroom. After half term from the 22nd of February, our foundation phase learners will start to return to school during that week. Children of critical workers and vulnerable learners, as well as those taking exams or assessments, and learners in special schools, will continue to be able to attend as they have done throughout the pandemic. We have prioritised our youngest learners because of the favourable evidence on transmission in younger children, and also because we know they find it the most difficult to learn remotely. Small numbers of vocational learners, including apprentices, will also be able to return to colleges. Again, this is because of difficulties with remote learning, as they will need to access training or workplace environments in order to undertake their practical qualifications. Following productive discussions with our union colleagues and local authorities and further education partners, we are introducing a number of additional measures to provide staff with an added level of assurance for their safe return to face-to-face teaching. This includes the introduction of twice-weekly testing for staff members, as well as increased financial support for new face coverings. We are providing an additional £5 million to support schools, colleges and local authorities to invest further in items that they need to keep their premises safe. As we all know, you only get one childhood, which is exactly why we are all working so hard to support young people back into schools so that they can learn alongside their friends. However, I need to be absolutely clear. We are told time and time again that our education premises are safe, but it is the added movement around them that contributes to the R number. So I must make a plea to all learners, to parents and carers. Please continue to follow the guidelines. By following the guidance, restricting contact with others, we are able to ensure that our children and young people are able to do what we all want, which is to be back learning alongside their friends. Thank you very much, and we'll now turn to questions from our colleagues in the media. And I understand this afternoon that we're going to start with Tyleri Glyn-Jones over at BBC Wales. Prynawn dda, Tyleri.
Prynawn da, Gweinidog, thank you so much. When will parents of older children find out whether their pupils will be able to go back to school? Will you set out a timetable for that?
Tyleri, as you know, our considerations about opening up of education for face-to-face learning for more of our pupils takes place as part of the wider government's review of coronavirus lockdowns. The next period of review will be announced on February the 19th. And we will hope to be able to give an indication at that point as to next steps for education. Clearly, for more of our young people to be back to face-to-face learning, we need to ensure that the statistics that Dr. Jones just outlined continue to be in the right direction, and we can help that happen by continuing to follow the rules. And I really must stress that today to parents. I'm so pleased that we're able to get foundation phase learners back to school, but that does not mean that everything else can go back to normal. We really need parents and carers to follow the guidance and to take real care, especially at the beginning and the end of the school gates, wearing masks at the school gates, socially distancing from other parents when you drop off or collect your children. And also a reminder that because your children are back in school, unfortunately we're not in a position to allow them to mix outside of school. So I'm afraid that's no play dates, no sleepovers, no birthday parties. And it's by following these rules and these regulations and this advice that we can minimise the disruption to education for those children that are able to go back, but also put us in a position, Larry, to allow more children back for face-to-face learning.
Diolch. I'm turning to catch-up now. We know that the pandemic has disproportionately affected those from the most disadvantaged backgrounds. What are your plans for helping all pupils to catch up, but particularly those from the most disadvantaged backgrounds?
Yeah, you're right, Larry. The disruption to education has meant that learning has been disrupted for all children, but we are particularly worried about our most disadvantaged children. That's why already, as part of our recovery programme, we've employed in excess of additional 1,000 teachers and teaching assistants who are already out there as extra members of support staff supporting our children. And as we move forward, we will outline further plans for both the short, medium and long-term recovery that we will need to put in place to support our teachers and as also to support pupils. But those additional members of staff are already out there supporting children. And can I just say once again, a massive thank you to our teachers, our teaching assistants and all those that are working in education. Schools may be closed for the majority of pupils for face-to-face learning, but that does not mean that learning is not happening. And I am bowled over every day by the innovation that schools have in trying to support learning even in these most challenging of times. So a huge thank you once again to our teachers and our support staff who are doing an amazing job balancing educating our children of key workers and vulnerable children who are in school, as well as combining that with home and distance learning. Adrian Masters now at ITV Wales. Good afternoon, Adrian.
Good afternoon, Minister, and this is a question both for you and for Dr. Jones, please. I'm at Aberbargoed Primary School, where they very much would like to be back fully in action at some stage, but they've seen data, they've been discussing data today, which shows that the number of cases in primary schools remains very high. Since September, 268 compared to 100 in secondary schools they see. So, as I say, at Aberbargoed, they very much want to return fully into action, but can you reassure them with that data that it'll be safe for them to do so?
Well, thank you, Adrian. And like you, I speak to teachers and head teachers every week. And the consistent message I get from them from every corner of the country is that they are desperate to get back to teaching their classes at school. And sometimes I have to rein in their enthusiasm. Only this week, talking to a head teacher up in North Wales who wants all of his children back. But we have to get that balance right between making sure that we can get some of our children back to face-to-face learning, but doing that in a way that is about assuring the safety within our school environments and building confidence, as well as managing the overall effect of more face-to-face learning on the pandemic. But let's be absolutely clear. Head teachers and local authorities have done an excellent job in keeping the school environment as safe as it possibly can be. And that's why we're announcing additional monies today to help them carry on doing that. It is the activities around schools that cause us greater levels of concern. And Dr. Jones can talk about the ONS survey and testing data that shows that for teachers and teaching assistants, then they can have assurance that their occupation is not putting them at risk.
I mean, the evidence is still very strong that in the youngest children, transmission is low. You know, they do not get severe forms of the disease and they do not tend to transmit it as much as adults or even elder teenagers. The one determinant that's been more obvious than any other throughout the pandemic has been the relationship between numbers of cases for pupils in schools and in teachers and the rates of transmission in the community. And we do know that clearly before Christmas, our transmission rates in the community were relatively high. And so it was not surprising there were cases in schools. But the transmission rates, as I described just now, are much lower now, and I hope they will continue to fall. And so we anticipate a lot less cases in schools than before. Even though transmission rates were so high before, in the autumn, with the presence of the new variant, the evidence about teachers' outcomes from the point of view of COVID infection and hospitalisation and death were very favourable during that time. Actually, teachers have very similar rates of COVID to the general population, even when community case rates were so high. So I think there's every reason to feel quite confident that the school environment is safe with the mitigations that the teachers have all, to an amazing extent, put in place.
Thank you both for that. And as a second question, also to both of you, please. The Police Federation of Wales has written an open letter to the First Minister saying that the Welsh Government has reneged on its commitment to protect police officers by not prioritising them for vaccines. So I wonder if I could get your response from the Welsh Government Minister and from Dr Jones to the suggestion that police officers feel unprotected on the front line.
Well, Adrian, I just want to begin by thanking police officers, the length and breadth of Wales, that have played a really, really important part in helping the government with the pandemic. And understandably, I understand they're out there very much on the front line, and I understand why they would feel concerned. I have to say, we are following the advice of independent experts in the field of vaccines and immunisation. The JCVI guidance is being followed by all 4 parts of the United Kingdom, and that vaccination priority list is aimed at reducing death. It's aimed at those individuals who we know, sadly, if they contract COVID-19, they are more likely to die from it. And that's why those groups are being prioritised. And of course, once the first 1 to 9 groups are completed, and we are doing so well, and we're on track to do that by the spring, then obviously we await further JCVI advice as to who should be vaccinated next. I understand why police are anxious to be vaccinated, of course I do, as along with other frontline workers, but we need to follow the JCV advice, which is aimed at reducing the number of deaths from this terrible disease.
Yes, I mean, there are a number of frontline workers who clearly are feeling frightened about their risk when they come across people who may be infectious, even if they're asymptomatic, and one completely understands that. At the moment, though, the rollout of the vaccination programme is not about who we value most or about those that are more kind of meaningful to our society in any way. It is absolutely focused on this issue of reducing hospitalisation and death due to COVID. And the main risk factor for death due to COVID is age. We also know that those in the clinically extremely vulnerable group are at higher risk, and they are part of the JCVI cohorts that we're going through now. If there were police officers or teachers who had chronic conditions who put them at risk, they would be part of these cohorts now as well. But the absolute focus, first of all, is to reduce the avoidable death rate. This is nothing about not valuing people's massive contribution to society, but it is absolutely focused on reducing deaths.
Well,
Thank you both.
thank you, Adrian. And we'll now move to Thomas Evans at S4C. Prynawn dda, Thomas.
Am da I chi, Gweinidog Addysg, diolch. You say that education is a priority for the Welsh Government. So can we expect all pupils to be back in school before other level 4 lockdown restrictions are eased? And to Dr Jones, how realistic do you think it is that we'll see all pupils back in schools before Easter?
Well, Thomas, it is absolutely our priority, and we will take every opportunity that is afforded to us by this virus and by the people of Wales who have worked so hard to drive those case rates down and to follow the rules. And so we will use every opportunity as part of the review process to use the headroom that has been created by people's sacrifice and hard work to get more children and young people back to face-to-face teaching. We need to do that gradually, and we need to do it carefully, and we need to monitor the impact of that. But I can assure you, in every discussion, prioritising education is what the Welsh Government will do.
Children and young people do, I fear, run the risk of being innocent bystanders in this pandemic. The pandemic doesn't threaten them directly so much as adults, but they are threatened by the control measures we have to put in place to protect everyone else. And so we are committed to seeing children back to school. It is not possible for all children to go back to school now. We do not have enough headroom for that. But we will be evaluating this change, and if we can do more, as the Minister has said, then more will be done. There are some reasons to feel that the position is more favourable than it was, though. Case rates are falling, and I hope will continue to fall because a lot of measures are still going to be in place for the time being. We're entering spring, or it's not too far away, so the weather will get better, and we think that seasonal effect will help. And of course, as we roll out the vaccine, the situation improves as well. So I do hope that it will not be too long before children can get back to school, but we're not in that position now.
Back to you, Thomas.
Diolch am hynny. We've spoken to a teaching union who's called on the Welsh Government to guarantee jobs throughout their induction periods for trainee teachers who had their education disrupted by the COVID-19 pandemic. You've spoken about the need for additional staff and what the Welsh Government has already done to ensure that. So will you as Education Minister make this pledge?
Well, we're very keen, first of all, to ensure that those teachers that are currently training to become fully qualified members of the profession are supported in that, and our ITE providers, our universities, are working really hard. And can I say a massive thank you to what their host schools and their partner schools who are continuing to support the traineeships of teachers. It would have been so easy for those schools not to take part in those partnerships with their higher education institutions. They've stepped up to the plate to ensure that that supply of teachers, new teachers into the profession is able to happen. As I said, we've been able to employ an additional over 1,000 members of staff in this academic year, and we will continue to work to develop our recovery plans, and I see an absolute future for our newly qualified staff in those programmes as we move forward. Now going to Adam Hale at PA. Adam.
Good afternoon to both of you. This one for the Education Minister. You've announced that pupils in Wales will return to the classroom earlier than those over in England, helped by more favourable conditions here. But to lifting Wales out of lockdown, will that have to happen at the same time as England is able to, considering all the issues we've learned during the pandemic related to issues of cross-border travel?
Well, I think it's right to acknowledge that we're able to make this announcement today with regards to younger pupils returning to school because of the figures that Dr. Jones has just spoken about. Fortunately, here in Wales, we've been able to drive those figures down to such an extent that we can make this positive announcement, as have our colleagues in Scotland, who find themselves in a similar position. As regards to other aspects of the lockdown, the First Minister and the Welsh Government will always take steps that are, the right steps for Wales. It would not be right for us to deprive children of their education in Wales when we're able to get some more back, because unfortunately cases haven't dropped so far in another part of the United Kingdom. But clearly, for reasons of clarity and people being able to understand and cross-border travel, we know that sometimes it can be complicated, and where we are able to work in tandem across the nations of the United Kingdom, then we will do that. But clearly today we are able, because the headroom has been created by the Welsh people, to be able to get our children back to school after half term for this particular age group.
Thank you. And for both or either of you for this one, the UK government has said that all adults aged 50 and over should receive the coronavirus vaccine by May, completing the JCVI's initial priority list. Is this a target that the Welsh Government recognises, is aiming for and has confidence of hitting?
Oh my goodness me, you'll have seen from the slides the tremendous efforts that have gone on in Wales to add real pace to the vaccination programme. We are vaccinating more people per head of 100,000 than any other part of the United Kingdom, and that is a tremendous logistical, professional and indeed a community response. There are lots of volunteers out there that are assisting our NHS, our primary care practitioners and GP surgeries. It's a tremendous effort, but Dr. Jones, I think we're on track to do just that, aren't we?
Yeah, I don't really have anything to add. That is the plan.
Thank you very much. We're now going to Abby Whittaker, Wales Online. Good afternoon, Abby.
Good afternoon, Minister. The first question is directed at Dr. Jones.
Sure.
Good afternoon, Dr. Jones. I'm sure everyone will be pleased to see that younger children can start going back. You said just now that you were evaluating when older children can go back and we can get them back more perhaps by next term, who knows. What are the criteria you're actually looking at? Where do we have to be on all those measurements, the infection rates, the capacity in the NHS? What is there an actual criteria where you say now we can start bringing those older children back? And if there isn't, why isn't there?
At times during the pandemic, it's been quite difficult to understand the impact of opening schools because it's happened at a time when lots of other changes have happened as well. But this is the most important change that's likely to happen over the next 2 or 3 weeks in Wales. And so we will be able to evaluate it quite clearly. It'll take 2 or 3 weeks before its impact on numbers comes through. But we will be looking at the sort of figures that I've shown you. So we'll be looking overall at the case rates because a lot of other restrictions are going to be in place, still exerting downward pressure on the R value. We'll be looking at test positivity rates. We'll be looking at the pressure on the NHS. And if we can see that the situation is we still have headroom without R going above 1, then we can do more. So those are the sort of measures that we will be looking at. And it's not just the absolute values, it's also the direction of travel. Are things improving and on an improving trajectory?
Thank you. This next question is for the Minister. Earlier this week, Minister, you said to me that we needed to have a debate about perhaps shortening the summer holidays and perhaps having a longer fire break half term in the autumn, etc., or perhaps a longer Christmas holiday. What are you basing that on? Are you expecting next academic year also to be disrupted, or are you just contingency planning in case it would be when you're suggesting those things?
I think it is important that we also try to take a longer term view. Obviously the vast majority of work, effort, energy and attention goes into the here and now, but I think it's really important, and indeed Sage talked about this, about trying to take a longer term view that allows us to plan more effectively. We know if we can take those decisions in advance, it gives more time for professionals and families to plan about how they can manage their lives, and allows professionals to have different methods of education ready to go and ready planned out and thought about how they're going to deliver it. So we do need to have those discussions. As to what the pandemic or the disease may look like in the autumn, then I think it is too early to tell. But Dr. Jones, as said earlier, that we think that there is definitely a seasonality element to COVID-19, and therefore we do have to think about what will the autumn and winter look like.
Yes, I mentioned the JCVI cohorts at the moment being vaccinated to reduce the death rate. And once those cohorts have been vaccinated, then the wider rollout across the population can start in order to try to control the pandemic and stop transmission. But we can't, until that happens, there will still need to be some restrictions in place. You can't just let it run riot through younger people for lots of reasons. Some of them end up in hospital, some will get long COVID. We want to reduce the harms of this. And then again, we're entering the winter and the seasonal effect. So it is unpredictable, but I don't think we'll be completely free of problems next winter either.
We'll now move to Daniel Bevan at LBC. Hi, Daniel.
Thank you, Minister, and Dr. Jones. Good afternoon to you both. This is a question for yourself, Minister. There's been renewed calls this morning to get teachers vaccinated. Now, of course, you said today that you're following the JCVI advice, but you don't have to follow that advice. That is something that you've chosen to do. So will you follow it regardless of what they say in the next cohort, or if they say that teachers aren't part of the next priority groups, will you push for teachers to get their first jabs?
Well, Daniel, when you're a part of a government that has set up an independent group of experts to provide you on advice on how to roll out a vaccination programme, it would be very strange for that said government then to ignore that advice. Next question.
Thank you, Minister. And you've announced further funding for protection on face masks, protection and face masks, but have you at all considered using or making face coverings mandatory in classrooms, particularly for older pupils that have in other parts of the UK? And this is for yourself, Dr. Jones, as well. Do you think that would help lower the levels of transmission in schools?
Well, Daniel, you're absolutely right. The effective and proper use of face coverings, especially good quality face coverings, does have an important role to play. Obviously, today we're talking about foundation phase children, and masks are not recommended for foundation phase children. But clearly, when talking about bringing older children back to school, then we will indeed have to review whether it would be in the best interests of mandating them to wear face masks within the classroom setting. We already recommend that older children should wear face masks on school transport or when moving around the school and where social distancing isn't possible, but that will be part of our consideration when we begin to think about, or we are thinking about bringing older children back to school. But the effective use of face masks in the right circumstances, done well, of the right quality, does have a role to play, Dr. Jones.
Yes, our position is we recommend their use, as the Minister said. I think to mandate their use, and there's quite an issue about mandating anything on the public, but I think to mandate their use we would need to have clear evidence that they were effective in protecting either pupils or teachers or reducing transmission in schools, and that evidence doesn't exist at present. But as I said before, young children have very good outcomes from COVID and are generally the safest in our pandemic at present, and teachers also have very similar outcomes to the general population.
Thank you, Daniel. We'll now move to Andrew Forgrave at the Daily Post. Good afternoon, Andrew.
Good afternoon to you, Minister. Good afternoon, Dr. Jones. Perhaps this is a question to you both, but Minister, earlier you referred to the need for parents to show responsibility to comply with the regulations once schools reopen. Does this imply that parents and their families pose the greatest risk to school infection levels and indeed to schools staying open?
Well, what I can say, Andrew, is that we know that when community levels of transmission rise, that makes keeping children in school more challenging. And more challenging because of additional cases, but also more challenging in terms of people being asked to self-isolate because they're a contact. That causes real problems in ensuring that we have the right number of staff in schools. That ensures that children aren't being asked to stay at home because they're a contact. So we know that there is a correlation between community rates and then the impact that that has on schools. Now, I know that parents are doing the very, very best they can. My goodness me, it is frustrating and challenging to be a parent at the moment. The message I'm trying to give to parents today is not because I believe that they have been reckless previously, but we don't want the signal that their children can go back to school as saying, well, that's okay, I can go back to normal life with my child. Unfortunately, we're not in that position. So it's not because we think parents have been reckless in the past, but we don't want parents to misunderstand this decision to allow foundation-phase children to go back to school to think, well, that's okay then, we can go back to playing in the park together, we can have sleepovers, we can have play dates, we can have birthday parties. We really need parents' help to help us keep the community transmission rates down, because that means their children can be in school, and we don't want people to misinterpret or think that this sign means things can go back to a more like normal. Unfortunately, we're going to have to keep on sticking to the rules that little bit longer. But as Dr. Jones says, there is hope and there is optimism that things can improve, so stick with it that bit longer. Back to you, Andrew.
Shall I come in as well? I think we've learned a lot throughout the pandemic about what happens around schools and through contact tracing and the TTP programme. And while there's transmission within schools, there's no doubt that does happen. Most of the evidence seems to be that it's about the social contacts that schools create outside the school. So it's all the associated activities. So it is partly the dropping off of children and picking up of children outside the school gate. It's partly the after-school activities, it's sports activities. These are all activities around the school that bring families together in a way that helps the virus spread. So we want to get children back to school, but we don't want all of those other contacts to happen. So there is a messaging issue here. This is about children getting back into school safely, but it's not about everybody else mixing more, because they are still restricted to the same extent.
Thank you to you both. Could I just touch on tourism? Many tourism businesses say they will not survive if they are unable to reopen by Easter. Can you offer them any hope at all?
I recognise that this has been a torrid time for businesses right the way across Wales, and particularly for our tourism sector, and I understand why they're so keen to open up, and I know that there will be many people here in Wales and indeed in other places that will want to take advantage of the fantastic hospitality that our tourism sector has to offer. But clearly we will need to keep all the science and evidence under review. It is simply far too soon for me to be able to make a prediction now that that is possible. But in the meantime, you'll be aware that my colleague Ken Skates, the Minister for the Economy, has made available another round of financial support, especially for the tourism and hospitality sectors that have taken a massive knock. And I would urge those businesses to be in touch with their local authority. If they've been in receipt of grants previously, my understanding that those grants will be paid automatically, but they should check in with their local authority to ensure that they're getting the support that they need and that they are entitled to. We'll now go to Andrew Nuttall at the Leader.
Thank you, Minister. This question is directed to yourself. There has been some sort of worrying, if the best word is probably caution, about easing the lockdown as one rather than, there's been more worry and concern about easing the lockdown as one than there is about locking down and as a general rule. Concerns here specifically in North Wales are that the figures, whilst they're lowering, are still some of the highest that are in Wales at the moment. Do you think that a national approach to schools will work? And if the need arises, will local authorities be taking sort of local action? And has this been discussed as a possibility by government?
Well, thank you for that, Andrew. And I recognise that rates in Flintshire and Wrexham are indeed higher. But as the Minister, I have to make a national all-Wales decision. And that is that our expectation is that all foundation phase learners will return from the 22nd. But we also understand that schools may want to have some flexibility in organising their timetable for learners, and they'll be consulting with parents about the best way to do that. And that's why we have built in some flexibility for local head teachers and local authorities to reflect on how best to do it for them.
Can I add something as well? Sorry, Minister. The rates in North Wales were, for a period of time, high. We think because the new variant became the dominant variant there first in Wales. But the pleasing thing since the restrictions have been in place over the last 7 weeks is that even with the new variant being dominant, the rates have come down considerably, and the difference between the worst and the best now is much, much less than it was and converging all the time. So we still hope the rates will come down, and it seems quite possible, and we hope it will be the case, that they will still converge, and so the difference will not be so great as time goes on.
Thank you, Dr. Jones. And back to you, Andrew.
Thank you. Second question was sort of directed at Dr. Jones. So Dr. Atherton, the Chief Medical Officer, has previously said that Wales, or I suppose the whole of the UK, have been watching other countries to sort of learn and replicate what is best practice and what works and what doesn't, and when it comes to bringing levels of the virus down. And even despite working hard in the lockdown, we still continue to see hundreds of cases a day, and sadly deaths continue to be upwards of 30 plus a day across the country, and restrictions will still stay in place, and they will be in place for quite a while if things are led to be believed by government. What more can be done to tighten up these numbers, and so where we can see a possible sort of like back where we were in the summer when we had numbers very low and some days we were happily reporting that no one had actually died from the virus?
The technical advisory group that gives advice in Wales, which the Minister mentioned at the beginning, does look very carefully at international evidence and international examples. It has an international subgroup, and every meeting has an international update on the state of the pandemic across the world and what different countries are doing. We do learn a lot from that. It is true that in Wales we've been hard hit by COVID, and there probably are reasons for that in terms of the health of the population and some of the inequalities maybe that we have at the UK. But at the moment, as I say, the situation appears a favourable one. We do have to persist with restrictions, we know, for the time being, because with the new variant we think that to relax too quickly will cause it to take off quite quickly as well. But it is in a much more favourable place than it was, and I hope that will now continue.
Thank you for that, Andrew. And that brings us to the end of the press conference this afternoon. Can I thank Dr. Jones for his time in joining me today? And can I thank the people of Wales? We're only able to make this decision today about the return of foundation phase pupils to schools because of all your hard work and sacrifice. And for that, I'm very grateful. Diolch yn fawr.